What is the role of sodium bicarbonate in the priming solution for CPB? A. It increases the pH of the solution. B. It acts as a nutrient source for tissues. C. It stabilizes blood pressure during surgery. D. It enhances clotting mechanisms. Answer: A. It increases the pH of the solution. Explanation: Sodium bicarbonate is added to the priming solution to act as a buffer, helping to maintain the pH of the blood and prevent acidosis during CPB. When blood is oxygenated and circulated through the bypass machine, CO2 buildup can lead to a decrease in pH, acidosis. Sodium bicarbonate neutralizes excess acid, maintaining a stable pH and ensuring proper metabolic function. Which of the following is a potential risk when using high-concentration sodium chloride in the priming solution during CPB? A. Hypotension due to fluid overload. B. Electrolyte disturbances, particularly hypernatremia. C. Decreased clotting ability due to hyperglycemia. D. Increased risk of metabolic alkalosis. Answer: B. Electrolyte disturbances, particularly hypernatremia. Explanation: High concentrations of sodium chloride in the priming solution can lead to electrolyte imbalances, particularly hypernatremia, elevated sodium levels. This can disrupt normal cellular function, lead to fluid shifts, and increase the risk of complications such as kidney dysfunction or central nervous system disturbances. What is the primary reason for using glucose in the priming solution for CPB? A. To improve clotting function. B. To provide an energy source for tissues during bypass. C. To increase blood pressure during surgery. D. To enhance the ability of the heart to contract. Answer: B. To provide an energy source for tissues during bypass. Explanation: Glucose is used in the priming solution to provide an energy source for tissues during CPB. As the heart and lungs are bypassed, there is a temporary reduction in nutrient delivery to tissues. Glucose acts as a vital fuel for cells, especially in high-demand organs like the brain and kidneys, ensuring metabolic processes can continue without interruption during surgery. What effect does the use of a non-buffered solution like normal saline have on the body during CPB? A. It can cause a rapid increase in pH, leading to alkalosis. B. It may cause acidosis due to the accumulation of CO2 during bypass. C. It can enhance clotting and increase the risk of thrombosis. D. It may lead to excessive hemolysis of red blood cells. Answer: B. It may cause acidosis due to the accumulation of CO2 during bypass. Explanation: Non-buffered solutions, such as normal saline, do not contain buffering agents like bicarbonate to help regulate the blood's pH. During CPB, the lack of normal circulation and oxygenation can lead to a buildup of carbon dioxide, which can result in acidosis. A buffered solution is preferred to avoid this issue and maintain pH balance. Why is it important to limit the use of potassium in priming solutions for CPB? A. Excessive potassium can cause hyperkalemia and arrhythmias. B. Potassium enhances the coagulation of blood. C. Potassium stabilizes blood pressure during surgery. D. Potassium increases the osmotic pressure of the solution. Answer: A. Excessive potassium can cause hyperkalemia and arrhythmias. Explanation: Potassium is a critical electrolyte in the body, especially for normal heart function. However, excessive potassium in the priming solution can lead to hyperkalemia, which can cause dangerous arrhythmias, irregular heart rhythms, including life-threatening conditions like ventricular fibrillation. Potassium levels must be carefully regulated during CPB to avoid these risks. What is the primary advantage of using a blood-based priming solution rather than a crystalloid solution for CPB? A. It is cheaper and more readily available. B. It contains a more complete range of proteins, cells, and electrolytes. C. It is less likely to cause fluid overload. D. It enhances the clotting ability of the blood. Answer: B. It contains a more complete range of proteins, cells, and electrolytes. Explanation: Blood-based priming solutions contain a full range of blood components, such as red blood cells, plasma proteins e.g., albumin, and platelets, which are critical for maintaining oxygen delivery, osmotic pressure, and coagulation during CPB. This makes blood-based solutions more effective at preserving homeostasis during surgery compared to crystalloid solutions, which may lack key components. In CPB circuits, what is the most significant risk when using an excessively high volume of priming solution? A. Increased risk of hemorrhage due to clotting problems. B. Fluid overload leading to decreased cardiac output. C. Hypoglycemia due to dilution of glucose levels. D. Electrolyte imbalance and arrhythmias. Answer: B. Fluid overload leading to decreased cardiac output. Explanation: using too much priming solution can cause fluid overload, diluting the patient's blood volume. This can lead to decreased cardiac output and inadequate perfusion during CPB, particularly in patients with compromised heart function. Proper monitoring and calculation of the priming volume are critical to avoid fluid overload. How does using a hypertonic priming solution affect the body during CPB? A. It can cause hemolysis due to the osmotic imbalance. B. It leads to increased fluid retention in tissues. C. It can lower blood pressure by drawing fluid from the bloodstream. D. It increases the risk of clotting by increasing viscosity. Answer: C. It can lower blood pressure by drawing fluid from the bloodstream. Explanation: a hypertonic priming solution has a higher concentration of solutes compared to the body's normal fluids. This causes fluid to shift from the blood into the tissues, leading to a decrease in circulating blood volume, which can lower blood pressure. This can reduce perfusion and result in complications such as organ hypoperfusion and edema. Which of the following is the primary reason for adding blood products to the priming solution during CPB? A. To improve oxygen carrying capacity. B. To enhance blood clotting during surgery. C. To reduce the risk of fluid overload. D. To increase the effectiveness of anesthesia. Answer: A. To improve oxygen carrying capacity. Explanation: blood products, such as red blood cells, are added to the priming solution to improve oxygen carrying capacity during CPB. While crystalloids or colloids may help maintain volume, they do not provide hemoglobin, which is necessary for oxygen transport. Blood products ensure that adequate oxygen delivery can be maintained to vital organs throughout the bypass procedure. In patients with liver disease, why is it important to avoid using large amounts of albumin in the CPB priming solution? A. It may cause hyperglycemia. B. It may worsen fluid retention and edema. C. It may cause a drop in blood pressure. D. It may increase the risk of bleeding. Answer: B. It may worsen fluid retention and edema. Explanation: in patients with liver disease, albumin is often produced at lower levels, and using large amounts of albumin in the CPB priming solution can exacerbate fluid retention and edema. This occurs because albumin increases oncotic pressure, drawing fluid from tissues into the bloodstream. In patients with liver dysfunction, this may be problematic, leading to further complications, particularly in the lungs and abdomen.